Good afternoon, everyone. My name is Temenuga Dacheva, and I work as a specialty doctor in Obstetrics and Gynaecology in Homerton University Hospital, a BSGE accredited center in East London. So this talk is on recovery after laparoscopy. There are quite a lot of useful platforms where you can find information on recovery after laparoscopy. On the nhs.uk website, you can find a generic information on laparoscopy and recovery, including recovery times and symptoms and situation where you should seek medical help and advice. On the Endometriosis UK website, there is a very useful leaflet on laparoscopic surgery for endometriosis. In this leaflet, there is a special section on recovery after that, which is called after the operation. Our Royal College of Obstetricians and Gynaecologists have produced 4 different leaflets, which you might find useful in case you're supposed to have a laparoscopy. There is a leaflet on endometriosis, which was recently published in 2018. There is a leaflet recovering well after laparoscopy, which is designed as suitable for women who are supposed to have laparoscopy for diagnostic purposes or having small or intermediate procedures, for example, like removal of a cyst from the ovary. There is another leaflet, which is called Recovering Well After Laparoscopic Hysterectomy. And back in 2019, the college has produced a leaflet called Morcellation for Myomectomy or Hysterectomy. So morcellation is a special technique which makes possible to cut the uterus in small pieces. And this is how we can avoid open surgery, and we can remove the uterus with keyhole surgery. All of the information provided in this leaflet are freely accessible. On our website, on Homerton University Hospital website, you can find our own patient information leaflets, including leaflets designed for women who are having laparoscopy. So the aim of this talk is not to go through all of these websites and leaflets. So I'm gonna go with you over the next slides about some key things to expect and to know. And I wanted you to be aware of all of these available leaflets so that you can go through them depending on what type of surgery you're supposed to have. And then get more additional information which is relevant for you. So at our hospital, we usually send the women home on the same day after having laparoscopy, including in situations where the uterus is removed. Very rarely, sometimes in special circumstances, especially if your operation was done late, you may need to stay in for the night and go home on the next day. The modern anesthetic usually have short-lasting after effects, and however, you may feel more sleepy after the procedure. And because the operation is done in general anesthesia, so you may have sore throat for the next few days. The minimum cuts that we do are 2. So we usually do the main the first cut in the belly button, and there are additional cuts on the left or right side, and the number can vary between 2 and 4. So the length of the cuts varies from 0.5 to 1.5 centimeter, which is 0.2 to 0.6 inches for people who are more familiar with inches. The stitches that we use are absorbable, so you don't have to have them removed. And then on top of that, in addition, we put either dressings or glue. The dressings you can take off in the next 1 to 2 days, and the glue you can peel it off or it can come off on its own. It is very important to keep the incisions dry, and that helps with healing. But you can have washing or showering usually on the next day. It's good to have someone around in case you need some help. And after the procedure, depending on what is done, so you may have some vaginal bleeding for the next 1 to 2 days. If a hormonal coil was inserted into the uterus, this may be, you may have bleeding for a little bit longer. If we did remove the uterus, especially if we removed it with the cervix, which is the bottom part of the uterus, you may have some stitches on the top of the vagina, so the bleeding may last a little bit longer. And if we did perform a procedure which is called dye test, where we insert a blue liquid through the cervix into the uterus to check whether the tubes are patent. So you may have unusually colored vaginal discharge for the next day. So it could be bluish or greenish or reddish. So it's good to know what procedure you had, what was done, in order to know what is normal and what is not. Why is it so important to be pain-free after the procedure? So 4 in 5 women will have pain after the operation on the first day after the operation. And 3 in 4 women will still take painkillers on the second day after the operation. There's so many good reasons why it's important to be pain-free with or without painkillers. It helps you with breathing. If you have good breathing, this avoids having lung infections and helps you with the recovery. It's much more easier to move and walk. You'll be able to sleep better, which again enhances the recovery after the operation. It is easier to exercise, and we know the importance of the physical exercises. Eating and drinking is much more easy. It is important for your bladder and for your bowel movements. And again, the social interaction, the interaction with the others is much more easy, and it is very important for the mental health. So there are very good reasons to be pain-free. So that's why it's important to help you, if possible, to deal with the pain. So there is a systematic review from November 2019, which was published in Journal of Obstetrics and Gynaecology of Canada, and they included 38 studies and checked what were the outcomes after surgery for women who had endometriosis. You may be surprised, but 70% of the studies did not report the relevant outcomes to evaluate pain, and 70%, roughly 70% of the study did not report on whether the women had another surgery after that. It is important that in the context of the topic today, that 34% of the women who had excision of the endometriosis or ablation combined with denervation of the pelvic nerves had pain after the operation, in comparison to 25% of the women who had just the excision of the endometriosis lesion. The worst outcome and results were for the women who had diagnostic surgery. That means that they had laparoscopy just to diagnose the endometriosis, and that endometriosis was diagnosed but was not removed. 77.4% of these women did not have any improvement in pain, which is quite understandable if you don't treat the disease. And 77.4% of these women need to have another surgery. So in a way, probably for some of them, this operation was avoidable. With respect to painkillers, we try to send you home with simple painkillers. So our first line painkiller is paracetamol, and you can take it either as a tablet by mouth, or you can avoid that and have it inserted as pessaries in the back passage. Then with non-steroidal anti-inflammatory drugs, it's our second line. However, we know that there's special circumstances where they're contraindicated. And codeine we usually want to avoid. However, it's something that we can give for short time of period after the operation. And we usually want to avoid it because it may lead to addiction and constipation. With respect to the non-steroidal anti-inflammatory drugs, we know that that is good for women with endometriosis, and ibuprofen is usually our preferred option. It has less side effects, but the anti-inflammatory properties are weaker. So naproxen has better efficacy, but the side effects are more, and the diclofenac medication is pretty much similar to naproxen. Mefenamic acid is a painkiller that is used sometimes by women with endometriosis, and it has mild anti-inflammatory properties, and sometimes it's been associated with diarrhea, so it's important to be aware of that. We know that some of the women with endometriosis, and especially after surgery, may have migraine. So sulfonamic acid may be a good choice for these women because it helps with pain, but also is licensed for treatment of migraine. As I mentioned already, there's some considerations, and unfortunately we can't give non-steroidal medications to everyone. We have to be cautious in women who want to aim for fertility. However, the link with reduced female fertility is reversible once you stop taking that medication. It's not the medication that it's recommended to take in women who have asthma, or if you have gastrointestinal disease, for example, a stomach ulcer or gastritis or hiatal hernia. It is linked to increased risk of blood clots, and surgery we know that any surgery, regardless whether it's just diagnostic or longer surgery, can lead to blood clots in the legs and in the lungs. With respect to things that you can do in order to avoid the impact on the gastrointestinal damage, so aim for the lowest dose, and if possible, try to take the medication with some bland food or milk, and if if possible, try to change the route of use. For example, use it as a pessary instead of tablets, or there's some creams and gels available. With respect to shoulder tip pain, up to 80% of the women who have laparoscopy will have shoulder tip pain, which is usually considered as a minor postoperative symptom, but it could be quite unpleasant experience for women who had that operation. We're not quite sure why the women have shoulder tip pain, and there are possibly 3 different reasons. So one theory is that the gas irritates the nerve, and then there is a referred pain to the shoulder because of that. Another theory is that despite the fact that we aim to remove all of the gas at the end of the operation, there's some leftovers, and then when you stand, it goes just under the right on the right side of your tummy, and then gives you this shoulder tip pain. Or there might be some tissue trauma with respect to the operation. Things to do in order to help with that. So walking, mobilizing is very important. Some people use heat bottles, so in front and on the back, and some women find a relief with peppermint tea or water, and also painkillers, simple analgesic as paracetamol, ibuprofen, and as I said, codeine is something that we rather want to avoid, but sometimes we can use this analgesic in order to help with pain relief. There is a Cochrane review published in January 2019 on what we can do in order to reduce the shoulder tip pain after gynecological laparoscopy. And the results are showing that the evidence of the results is low or moderate quality, so it's not very good. And there are things that we can do probably to improve that. So there is a special way how we can release the gas at the end of the operation, some fluids that we can insert in the tummy at the end of the operation, potentially leaving a drain for a short time, and also through the incisions through the port to leave anesthetic in the tummy. Scar numbness or pain is another big thing for women who have laparoscopy, for some of them. So as I said, the incisions are pretty small, so 0.5 to 1.5 centimeter. However, inadvertently, there is some nerve damage when we do that, and then the scar tissue that is left is less elastic, so it's not so stretchy as the rest of the skin that was not cut. So for some women, they may have pins and needles sensation after the procedure, and sometimes this can be long-lasting, and sometimes there might be some itching. So usually the good thing is that these symptoms improve over time. And in order to help with that, there is some suggestion that a gentle massage might be helpful, use of moisturizers. There's some silicone gels or silicone sheets that can be applied over the incision scars. And if the procedure was done in the summer, or if you're exposed to lots of sun, it might be a good idea to use sunscreen. If there is something unusual that you notice, it's good to contact your doctor. For example, if there is a knot, swelling, if the area is red for a long time, so if it's if there's any evidence of infection, if there's any unusual discharge, not just as in relation to infection, but also in relation to a possible endometriosis, like bladder discharge. So the incidence of endometriosis in the belly button is very small. So it's between 0.5% and 1% of all endometriosis. And it can be interesting, could be primary. That means without having a surgery beforehand, or it could be secondary. It could be after operation that you had laparoscopy. And what is more common is something that's called umbilical incisional hernia, but actually it can be, you can have a hernia with any of the other scars. And again, luckily, this is very, very rare. And we do put some additional stitches if the incision is about 1 centimeter or more, in order to avoid that. It usually happens in the first few weeks after the operation, and the bowel surgeons, they don't want to repair this straight away. So usually we leave it a few weeks before we assess that, unless there is an emergency. And again, just to repeat what I've just said, these complications are very rare, but it's good to know about them. I've mentioned already about the link with laparoscopy and blood clots. So there are a few things that you can do in order to avoid this from happening. And there are some individual risk factors, and also the procedure itself may be linked to a lower or higher risk of having blood clots. But generally speaking, being as mobile as you can, as early as you can, it's very, very important. There's some exercises that you can do when you're resting. For example, pump each foot up and down briskly for 30 seconds by moving your ankle. Move each foot in a circular motion for 30 seconds. Bend and straighten your legs 3 times for each leg. Sometimes we give a medication in order to reduce the risk of having blood clots, and we usually give to everyone compression stockings, especially during the stay in hospital and during the procedure. When we do the operation, so we change the position. So usually the position that we have in theaters is head down and bottom up. And then with the instruments, we manipulate on the bowels, the medications that we use during the procedure. All of that can give you some nausea, some sickness, and sometimes even you may have vomiting after the operation. So medications that we use are anti-sickness, and the general principles is to have light meal, low-fat food. Some women like ginger in their diet, and also changing in the position. So you may find that this is better in some special positions. Bowel symptoms, you may have some bowel symptoms after operations. It could be constipation. Some women can have bloating, especially trapped wind, and this could be really, really very painful. And some women can have diarrhea. And here are some tips on what kind of food you can do and what interventions you can try in order to help with that. It is very important for everyone who has laparoscopy. Before we send them home, we want to see that they're able to empty their bladder, because the women who are not able to pass urine after the operation, as you can see, the numbers vary quite widely between 5% and 70%. Sometimes we always empty the bladder before we start the procedure, and sometimes women can develop infection after the procedure, in which case antibiotics is the right treatment. It is very, very normal, just to mention, to have some pressure in the bladder, pressure sensation, and the need to wee more often. And then it's not very clear why. Is it because of the medications, because the operation itself, but also sometimes the gas that we use during the procedure can lead to that. And don't panic, it could be normal. Hormonal treatment, this is not valid for everyone. Some women will have the hormonal coil inserted at the procedure, and we recommend to see the GP 6 weeks later for strength check. And if your ovary has been removed during the operation, so you may be offered hormone replacement treatment starting on the same day after the operation, or sometimes you may need to have gonipeptide injections or tibolone. And again, all of this can have an impact on your recovery after the procedure. This slide is quite important for me, and I hear quite often that women having laparoscopy can have surgical blues or even depression. And it is important to know that this can be part of the recovery process. There's so many fears that we have when you're supposed to have laparoscopy, even if it's just for diagnostic purposes, but also if it's like it's not very clear. There's so many questions with respect to the anesthesia. Then after the operation, were there any complications? What were the findings? How was the operation? Was everything excised? What is next to come? Do I need to have more operations in the future or now? So then the recovery process takes a while. The pain afterwards, will it stop? Will it come back? What kind of diet, exercises? Then the follow-ups with the services. As I said, some of the women may have medical therapy afterwards, or can be put in the artificial menopause because the ovaries were removed or because of the injections that we use. There's some anxiety, general, and also with respect to fertility for some of the women having laparoscopy for endometriosis. It is good to have a buddy in the recovery process afterwards, and it's good to talk with others. It's good to be active. However, sometimes you may feel more tired, so give yourself some time if that's needed, because this may be helpful as well. And healthy lifestyle is quite important. So last week, the week 10 to 6th of May was the Mental Health Awareness Week. And there is some things that we can do to be happier. Try to manage the stress levels, enjoy yourself, boost your self-esteem, have a healthy lifestyle, talk and share with others, build your resilience. And my challenge to everyone is, when you watch this presentation, please try and do something, at least one good thing for you on this day. Returning to work, again, could be different for different procedures, but also for different people as well. So it could be 1 week for a minor procedure, and it could be could take up to 6 weeks or sometimes even longer. So please refer to the leaflets that I've mentioned at the beginning of this talk. And just to summarize, be aware of the patient information leaflets that are available. There is more information that you can find there, and they're freely accessible. Then the recovery after laparoscopy, it is not just physical, but it's more complex. So it involves emotional and mental well-being and recovery. Be aware, and it's good to check what with your health service provider, what can you expect after the surgery, what is the pathway, seeing GP or seeing surgeons, in case you need some debrief after the operation, or to discuss the plan, how to proceed next, or in case of complications, because sometimes the interaction with the services after the operation is a little bit lost. And be mindful that the recovery after the operation takes time. And one thing that we know that is good is to have a buddy if we can. But yes, as I said, the services, the health services are here, and we usually try our best to support you in your journey after the laparoscopy for endometriosis. So here I'm going to end up my talk, and I hope that you enjoyed that, and I hope that you'll find this information useful. Thank you very much.